Okay, let's get this party started. Welcome to Labor and Health on Monday, the 26th, February, correct? Yeah, I lose track of my months. Welcome, we got 4 bills in front of us today. We're gonna change up the order a little bit. If you noticed, if you looked at all these bills, some of them are very short. It should not take a long amount of time. But we're gonna start out with House Bill 66 because the firefighters have got some commitments this morning. And we need to get them out of here if we can they're gonna go visit with the men in the upper office. So we're gonna start out with that one and then we'll determine the order after we get going. So let's open with House Bill 66 and I don't see the sponsor here. Shame on him. That's okay. We will do it without him. We have a couple co-sponsors with us. House Bill 66 is firefighter cancer screening benefits. Let's start with a roll call if we can, Donna.
Senator Barlow.
Excused?
Senator Bouchard. Here. Senator Dockstader. Here. Senator Hutchings. Here. Chairman Baldwin.
Here.
We have 4 present and 1 excused.
We have a quorum. Committee, if you'd open up to House Bill 66. Firefighter cancer screening benefits. This is sponsored by Representative Brown. You'll see that I guess I'm the only co-sponsor here, so I will go ahead and present this to you and then we'll take it out to the agencies real quick. What this does essentially, committee, is that this bill makes available for firefighters to receive annual cancer screenings under the Workmen's Compensation Act. As you're probably aware, you're getting tired of me talking about firefighters, but I'm going to do it anyway. Firefighters that are significant increased risk for cancer from multiple sources. One of those things being the combustion products in fire. There's a number of chemicals present in a lot of our products that we don't think of, such as, carpets and furniture, in addition to all the other things that are out there that are on fire. And firefighters are exposed to a high amount of cancer-causing agents. And so firefighters, and one of the people who present to us here today will give us some bigger numbers on that, but there's a significant increase in firefighter cancers. And there's the representative in the nick of time.
Boy, I saw number 4 on there, Mr. Chairman. I thought I got time.
No, you got to stay on your toes for this committee.
Boy, I guess.
Welcome,
Mr. Chairman, my
Representative.
apologies.
Welcome. No apology needed. I'll let you go ahead and present the bill to us if you would.
Well, Mr. Chairman, it sounds like you were going through the majority of the bill itself. What I will start with, committee is...
Tell us who you are.
My name is Landon Brown, Chairman of the Transportation, Highway, Military Affairs Committee on the House side. And then I've been serving here for 8 years, and my first year in, we actually passed, actually it was my second year in, we passed the presumptive liability bill that came through both bodies and said, if you're diagnosed with cancer, we're gonna cover that through workers' comp. And that was a pretty good bill. I think it worked its way through and had a lot of compromise through it. As a matter of fact, on our side, we were able to determine the 10-year phase-in period that actually had a lot of compromise. So what I brought to you guys today, Mr. Chairman, is a slight extension of that. And this is, quite truthfully, this is a dying man's last wish. One of my best friends at the time, last April, grabbed me as I was walking out of church, and we had just finished praying for another one of my friends who had stage 4 cancer. And he stopped me and he says, well, I was just diagnosed with stage 4 colon cancer, and I've got 6 months to live. And we stayed in contact, and I was only able to see him a couple of times during that time frame. And every time he'd go into the hospital, he didn't want to see anybody. But day before he passed away, we were sitting out on his front porch, and he asked me to run a bill, something along this line, just in an effort to try to prevent this from happening. He was 47 years old. 47 years old and died of colon cancer. And had it been caught early, it could have absolutely been a much better scenario, not only for him, but his family, his 2 children and his wife. And his wife is behind us, or behind me today. She'll be speaking as well. So all this bill is doing, Mr. Chairman, is extending the same protection that we offered as far as presumptive liability. We're trying to catch those diseases early. And so this is cancer screening early. And we did have the Department of Health, which brought us some really good amendments in that you'll see in the engrossed copy. And it basically got rid of the term annual and brought in at medically relevant periods. And that was in an effort to say, hey, look, sometimes an oncologist recognizes there may need to be an earlier detection, or we may need to do more than one blood screening at a time. And it's not going to just be annual, and we're not going to cover it just that way. So we did update that language. And then the other update that we did, Mr. Chairman, bear with me here as I'm getting to my amendments. We did change the Centers for Disease Control to NIOSH, and that's the National Institute of Occupational Safety and Health. And they're the ones that actually provide the updated list for who actually is exposed to what carcinogens, that kind of stuff. So this bill does not cost the taxpayers a dime. The way I have this designed is this actually flows through the $2 billion trust fund that we have for workers' comp. And I believe I saw Jason as I walked in here, so Mr. Wolf will go over that with you guys. This committee is no stranger to the workers' comp pool and how that works. But basically, you'll see in the fiscal note, there's a $2 million expenditure and $2 million refund back on that expenditure. And that's just basically us paying ourselves as that rolls through the process. And this isn't an effort, like I say, to save more lives. If we can catch these cancers beforehand, it will not only save lives, but it will also reduce the amount of money that we're paying out on workers' comp claims to the hospitals for these expensive treatments. Well over $1 million worth of information was given to me for my friend Aaron Booker. And so you will see 2714-901, the short title is labeled as the Aaron Booker Firefighter Cancer Screening Act. I'd like that to stay in there. That's a pretty selfish push. I will tell you, I've had quite a few people across the state tell me, well, I've lost a loved one, and my sympathies to them. This was my dying friend's wish, and so I'd like to keep that in there. Beyond that, Mr. Chairman, that is really what the bill does. We have not changed much of anything else in here. We are going to offer up the department to make any rules necessary. That's in section 3, and then section 4 is just that portion becomes effective immediately, and then the rest of it becomes effective on July 1st. And with that, Mr. Chairman, I could go through all the extra stuff that you've already gone through, but that's the bill in a nutshell, and I know you guys have got plenty of other work to do this morning as well, so I'll stand for any questions.
Very good. Questions for Representative Brown? Senator Hutchins.
Thank you, Mr. Chair. Representative Brown.
Mike, please.
There we go. Questions on page 2, where you have line 17, starts at the end of 16. Any person employed by a municipal corporation or private organization who devotes the person's entire time of employment to the provision of fire protection service, blah, blah, blah. What are we talking about there? Dispatcher, secretary, what are we talking about in those
Representative
lines?
Brown.
Thank you.
Mr. Chairman, Senator Hutchings, that's a good question. And the way that we have this designed is the exact same language that was passed on the presumptive liability. So anybody who was originally covered underneath the presumptive liability is thus transferred as well. If that were to go through and there was anybody to be brought forward on that, I do believe that the statutes that are lined out in here, which I do have those saved up. That is everything from a city firefighter to a volunteer firefighter with our fire districts. Also to, I think a big portion of where this one comes in that I was actually questioned on after we passed the bill out of our body was, what about the people who work for an airport, right? We don't actually label them out in this particular area. We have people who are firefighters at the airport, and they're truly exposed to high levels of carcinogens, especially with airplane fuel. So that would be the area that's covered underneath there. When it's in the provision of fire protection service, I don't believe that it would cover anything with dispatch or anything along those lines. I don't believe they're the ones that we're trying to cover with this. And if the committee feels the need to tighten that language up anymore, we certainly can. But again, I will say this is identical language that was passed through for the presumptive liability information.
Thank you, Ms. Representative Brown. And there was another question.
Follow up, go ahead.
Thank you. I'll let somebody else speak and then I'll come back to it because I
Okay.
think I was
Senator
right in the
Dockstader
middle
had a
of it.
question.
Thank you. Representative, with the fiscal impact, what did the workers' comp folks say when they came to your committee?
Mr. Chairman, Senator Dockstader, so there's two things that are of interest into this, right? There is the $2 million out, the $2 million in, so it's ultimately a wash. The interesting thing about this is this will actually end up saving in the long run, it's hoped, that this will end up saving cities, towns, and counties on their liability pool, because those that are exposed, that's actually the pool itself is the cities, the towns, they're all in there. It's not just the firefighters. And so if we're able to catch these expensive diseases, cancers early, and we're able to treat them for less money, that would actually end up being a reduction to their workers' premiums, workers' comp premiums. So that's a hope. We can't guarantee that, but that is one of the things that they said that they believe would probably likely happen with this.
Thank you. Quick
Okay.
follow-up.
Follow-up.
Workers' comp did attend? the
Yes.
hearing? Okay,
Yes.
thank you.
Go ahead, Senator Hutchins.
Okay, the question was, thank you, Mr. Chair, Representative Brown, was on the types of cancer. What evidence, if any, do you have to warrant all the different kinds of cancers we see, breast cancer, colon cancer, prostate? What's going on that you're saying, wow, because I'm a firefighter, more of us are getting these types of cancer? Can you tell me about that?
Certainly, Mr.
Representative
Chairman,
Brown.
Senator Hutchings, what that boils down to again is as I mentioned in the changeover from a few of the amendments that we made in our committee over, one of the things that we changed was the Centers for Disease Control over to the National Institute of Occupational Safety and Health, NIOSH. And they actually collect all these statistics, and they actually have all of this information that is labeled out. And that's why we also provide a little bit of wiggle room in there, if you will, of some of the information that they may be able to get something that we haven't laid out in this, right? If there's an additional cancer that's not laid out in this particular bill, but NIOSH has determined that it's a higher level for cancer screening, then it would be covered underneath this. But we do have empirical data that proves firefighters are well over the general public as far as cancer diagnosis, as well as the death rate for firefighters by cancer.
Thank you.
Good. Further questions, committee? Seeing none, we'll let you take a break for a little while. Don't go away, though.
Won't be anywhere,
In the
Mr. Chairman. Thanks
neighborhood.
again, and my
Let's hear from any
apologies.
departments first. Let's go ahead. He's anxious. He was on the front row. Welcome back to the committee. Go ahead and introduce yourself.
Mr. Chairman, Jason Wolf with the Department of Workforce Services. Representative Brown did a great job of laying it out. I just wanted to be present for any questions that the committee might have.
Questions for Workforce Services? I think you got off the hook easily today. Oh, there's one. Senator Bouchard.
Thank you, Mr. Chairman. Can you tell me, when we did the last bill that's tied to this, can you tell me what we've done to the health of the funds? Has it changed any of it, or what happened when we implemented that program?
Go ahead.
Mr. Chairman, Senator Bouchard, I had given some information to Representative Brown. And since, I think we passed that bill in 2017, since that time, we've had 18 firefighters file for the cancer presumption. Unfortunately, 6 of those have resulted in death. I think we've paid right in the neighborhood of about $4.6 million over those 18 claims in treatment and fatality benefits.
Okay. Further questions? Follow-up.
Thank you, Mr. Chairman. So of that money, where was the health of the account? Were we able to invest and make money back and put that money back, or where? So I'm trying to figure out where the health is in that account.
Sure.
Go ahead, sir.
Mr. Chairman, Senator Bouchard, so currently, as of today, the fund's right around $2.6 billion. So 4.6 million in total benefits paid out isn't a whole lot, and compared to that, I would say that similar to the way the fiscal impact is laid out here for this particular bill, the actuary, when they figure the rates for, the cities, municipalities, and et cetera, some of that money is recouped in their base rate because we take into account those charges. So as far as did it decrease the health of the fund? It's hard to say, unlikely, because those entities are being charged a rate to hopefully recoup that money paid out over a period of time.
Follow-up question. Go ahead, Senator.
Well, I wanted to shift the focus here, Mr. Chairman. So when we look at these cancers here, I mean, I would think that all the chemicals that we know are a problem, plus some of the, maybe from history of what we have in the cancers, isn't there more specific testing maybe that, I mean, because I'm looking at some of these, the way we're screening here. And I mean, are these similar? These aren't similar to the cancers that we know people get, are they? I mean, like with the contact with the foam, what kind of cancer does that? I mean, like for instance, historically, when you had 18 people, what cancers did they have? Where were they? How does that relate to where we have this testing in the bill?
Go ahead.
Mr. Chairman, I think, and Senator Bouchard, ironically, when we look at the 18 claims that we have filed with us now, a fair portion of those are either testicular cancer, bladder cancer, or esophageal cancer. So I think in this particular bill, we have on page 4 that Romanet 4 that kind of is a catch-all for routine screenings for any other cancers. I think these are just some basic ones that NIOSH has laid out that are more prevalent in firefighters than others, if that makes sense.
Follow-up questions, further questions? Senator Hutchins.
Thank you, Mr. Chair. I too kind of question, it's like you had 18 firefighters and they had these types of cancer. How are you saying that what they did as firefighters related to the cancer? Could they have gotten that type of cancer anyway? Besides, there's something in this foam that causes testicular cancer. And every firefighter who touches this is gonna get testicular cancer because of this foam. Or is it, we're just presuming if you get cancer, it's because of this foam? That there's really nothing to say that the foam causes it. I think that's where you were going, because I'm trying to figure out, or that's where I'm going. How do we know?
Mr. Chairman, Senator Hutchins, I guess we don't know. I guess the studies that are out there by NIOSH and other entities indicate that firefighters are statistically prone more than the general public to these cancers. So, and that's just the nature of the presumption is
Yeah.
that we're presuming the work related more likely than not to the cancer.
And I think you'll probably hear some better answer towards that with some of the other folks that testify. The studies are significant, and you'll hear more of that. We heard that in testimony about the presumptive. Further questions, committers? Can we move on to somebody else here? Okay, we'll give you a break. Other departments, Department of Health. No comment. You've said that a lot this year, but we'll let you off look into any other state departments, agencies here. No, let's first hear from Mrs. Booker, if we could. Welcome to the Senate Committee. You know the drill. You've been through all this. Welcome.
Mic on? Okay. Good morning. Thank you. I'm so honored to be here. My name is Courtney Booker, and Aaron Booker was my husband. And I just want to start by thanking you for allowing me to come and speak to you today on his behalf, unfortunately. Aaron was my husband for 20 years. And until a little over a year ago, our lives were a fairy tale. Aaron was a firefighter for over 20 years, a volunteer before he was on the paid department, and this was just his dream job. He lived and breathed firefighting. A year ago, at the age of 46, when he was diagnosed with job-related colon cancer, our world was rocked. We never imagined that something he loved so much could or would destroy us. And cancer is devastating to everyone, but I can't even tell you how much your life changes when you are given 12 to 18 months to live. I'm unable to find the words to even express the magnitude of what that feels like. Aaron was healthy, he was active, he took great care of himself. He went to the doctor regularly. He even had a colonoscopy a year before he was diagnosed. And this was not a man that anyone would suspect could be overcome with cancer. But these cancers don't affect the general public the way they affect firefighters. Due to the dangers and hazards they face every day, they're at a higher risk of getting and ultimately dying from these cancers at an extraordinarily young age. Aaron was 46 when he discovered he had colon cancer, and he died 8 months to the day from that diagnosis. He went from a vibrant, healthy father, husband, and firefighter to a man that I could almost carry. He lost over 40 pounds in the last 2.5 months of his life, and he was unable to even hold his head up, much like a newborn. Aaron was my person, my support, my protector, my best friend. We spent 23 amazing years together, and it wasn't enough. We have 2 amazing kids that are just entering adulthood without their father to love, protect, and guide them. Our friends and families have had to endure the loss and watch as I stumble to pick up the pieces of my shattered life. One of my wishes is that no one ever has to interact with a firefighter, because when that happens, it probably means it's one of the worst days of your life. Whether it's from a fire, car accident, or a million other worst-case scenarios, when everyone else is in crisis and running from danger, they are calm and running toward it in a selfless act to help strangers. They don't concern themselves with the dangers they are facing or the lasting effects that those dangers will have on them. However, those dangers are very real and ever-present. Approving this bill means you will help ensure that not only firefighters are safer, but you and your families are safer as well. We are making sure that those fire trucks are manned with healthy men and women that will come to our rescue night and day. This bill is designed to allow firefighters the opportunity to get screened for cancer early and often. It is an opportunity for us to take care of those that take care of us. It is an opportunity to save lives in a very real way. Please approve House Bill 66, the Aaron Booker Firefighter Cancer Screening Act, and help honor Aaron by saving his brothers and sisters in the fire service. You can make sure that hope and his name live on with the impact you will make on this state when you approve this bill. Thank you.
Questions from Mrs. Booker? No questions. We just admire you for being here.
Thank you.
Thank
I'm
you
very
very
honored.
much. Next, I'd kind of like to hear from some of the fire folks that are out here. And if I can direct your comments, whoever, don't all jump up at once, but please jump up at once. We have 4 seats. I see 3 of you. Kevin, you better get up here. I want you to address, if you would, not just the bill, but address what the fire service is doing in preventative measures toward the known causes of cancer, right? That will be a benefit to the committee as well. So introduce yourselves, go in whatever order you want, and please proceed.
Thank you, Mr. Chairman. My name is Kevin Reddy. I am the president of the Federated Firefighters of Wyoming. I represent the majority of the career firefighters in the state. And I'd just like to urge your strong support for House Bill 66. As you've heard from various different witnesses, cancer is prevalent in the fire service. We've been studying this phenomena for the past 20 years or so. And what we're finding is a lot of the chemical makeup of the firefighting itself is changing. A generation ago, most of the fibers that were burning in house fires were natural in origin, cottons, linens, woods, etc. Now everything is pretty much petroleum-based. So the chemical makeup has changed significantly, and the toxic nature of the products that combustion has increased drastically. With that, we've also seen an increase of PFAS that has been used in our firefighting foam, our flame retardants in our furniture and carpets. It's also laced in our bunker gear in the thermal barrier. PFAS is one of these cancer-causing forever chemicals that we're trying to figure out how to remove from our society. But all these kind of correlate to a larger increase in cancer in our populations. Just to lay out, I'm a Wyoming kid. I grew up in Casper. I attended Casper College, and that's where I started my fire science career. It's where I met Aaron Booker, who's a classmate of mine. Our first wildland teacher would succumb to occupational cancer. He was a Casper firefighter. My first job was in Sundance, Wyoming. I fought wildland fires. My first engine boss would succumb to occupational cancer. I came to Cheyenne in 2001. The senior firefighter on my shift and my first lieutenant would die from occupational cancer. And last August, we laid Aaron to rest, one of my classmates, all due to occupational cancer. It's a little wrenching. And I'm just one firefighter in Wyoming. There's not that many of us, and I'm sure all of us have very similar stories. So if we can catch these cancers earlier, start screening for them in populations where we don't see these cancers show up, hopefully we can catch them early, get the disease in remission. We want to get back on the trucks, get back on the job, and spend a little more time with our families. I'll use testicular cancer as an example. Firefighters are 50% more likely to contract testicular cancer. In my small involvement in the fire world, I've known 3 of my comrades that have contracted testicular cancer, which predominantly strikes older adolescent males and young adult males. All 3 of these guys were in their late 40s and early 50s when they contracted testicular cancer, and unfortunately, one of them passed away. Thank you for your time, Mr. Chairman.
Mr. Chairman, members of the committee, good morning. My name is Jim Wamsley. I'm the fire chief for the city of Rock Springs and also the second vice president of the Wyoming Fire Chiefs Association. Mr. Chairman, regarding your question, what are we doing to help prevent cancer amongst our ranks? During the last probably, I would guess, 10 years, there's been a lot of efforts concentrated on determining how we are exposed, how we can mitigate that exposure, and how we can prevent the occurrence of cancer in spite of all the external factors that affect us. Some of the things that we are doing in our department and in many departments across the United States, clean cabs. Used to be when you were done with the fire, you just jumped back in the truck, came back, the SCBA, the self-contained breathing apparatus, the turnout gear that we wear in a fire, all covered with soot, went with you, contaminated the inside of the truck. We tromped through the station, through the day areas, through bedrooms with that gear on. We didn't necessarily do any kind of gross decon, but the last 10 years have seen a significant change in what our practices are so that we can make sure that we have healthy personnel that respond, who don't get exposed or have minimal exposure, I should say, to these carcinogens. Annual physicals is a big part of what we do, along with other health measures such as diet and exercise. We have turnout extractors, they call them. It's a high-powered washing machine that we wash our turnout gear with. We do our best to make sure that our firefighters have clean gear on every call so that we're not cross-contaminating each other, so that we're not bringing those contaminants into the station with us and certainly not taking them home to our families. One of the great landmark reports that came out not too long ago came from the Volunteer and Combination Officers section of the International Association of Fire Chiefs. The Lavender Ribbon Report sets out many guidelines for preventative measures against cancer, and it was recently updated, I believe, last year. So that's one of our guides that we use.